Hi everybody, welcome to this session. In this session, we are going to discuss previous year questions from NEET PG 2022. Shall we start? Let's start with the first question. Identify the type of cartilage. Cartilage as such is a very high yield topic. Frequently, we get questions from this in your competitive examination. So, yes, before answering it, let's move on to a brief discussion. What do you think are the components that make up the cartilage? The cells of the cartilage, they are called the chondrocytes. And these chondrocytes are located in a cavity within the matrix. It's called chondrocytes in lacunae, right? And then the extracellular matrix, that is made up of the fibrous component and the ground substance. What are the fibers you know? Collagen fiber, elastic fiber, reticular fiber, isn't it? Reticular fibers, you know, they form the supportive framework of the lymphatic tissue, right? And the ground substance, it consists of glycosaminoglycans, proteoglycans, and so on. So these are the components that make up the cartilage. What is the outermost covering of the cartilage called? Periosteum. What are the three types of cartilage you know? Hyaline cartilage, elastic cartilage, and fibrocartilage. Come on, let us look into it. The hyaline cartilage, it has a perichondrium, and as I told you, the perichondrium is the outermost layer of the cartilage, isn't it? This perichondrium, it consists of two layers. An outer fibrous layer made up of collagen fibers and inner cellular layer. The fibrous layer of the perichondrium is made up of type 1 collagen fiber, right? And coming to the matrix as such. So here we get to see collagen fibers, but the collagen fibrils, they have the same refractive index as that of the ground substance. So you'll not be able to see any fibers within the matrix. Hence, we call it as homogeneous matrix. This term is very exclusive of hyaline cartilage. The term hyalose, it means glass-like, a transparent matrix, because the collagen fibrils, they have the same refractive index as that of the, yes, the ground substance in the matrix, right? And then another feature very exclusive of hyaline cartilages about the matrix is, can you see? It is bluish. We call it as intensely basophilic matrix. Why so? Because the chondrocytes, they are surrounded by the newly formed matrix, which is rich in proteoglycans. That gives it a bluish hue, right? So we call it as intensely basophilic homogeneous matrix, very characteristic of hyaline cartilage. Coming to the cellular component, that is also interesting. Can you appreciate the cells are not singly placed, but they are arranged as groups, and we call them as isogenous cell nest. The daughter cells, which are derived from the parent cell by mitosis, they remain close to the parent cell, and this is called as isogenous cell nest. Very characteristic of hyaline cartilage. So each isogenous cell nest, it may contain as much as 3 to or like 4 to 8 cells in a hyaline cartilage. The elastic cartilage also, we have isogenous cell nest, but they have smaller cell numbers, right, like 2 to 4, okay? And the matrix, the collagen fibrils, I told you they have the same refractive index and it appears transparent. The fibers present there, they are made up of type 2 collagen, right? So come on, let's summarize the features of hyaline cartilage. It has a perichondrium. The cells are arranged in isogenous cell nest. And what type of matrix we have? Intensely basophilic homogeneous matrix, right? The matrix that immediately surrounds one newly formed cell. It's called capsular matrix. And the matrix that surrounds the isogenous cell group, it is called territorial matrix. Okay, that is less basophilic. And then between the isogenous cell nest, okay, it is going to be less basophilic. That is called interterritorial matrix. Coming to elastic cartilage, why do you think it's called elastic cartilage? Because the matrix contains more amount of elastic fibers, right? The elastic fibers present here, they are more numerous, they are thick, dense and show branching pattern, right? Very, very characteristic of elastic cartilage. And as you see here, the perichondrium is present. The matrix will have type 2 collagen fibers. And again, the cells that you see here arranged as isogenous cell nest, but just fewer number, 2 to 4. Okay, so the characteristic features of elastic cartilage, let us summarize. It has a perichondrium. The perichondrium of hyaline and elastic cartilage made up of type 1 collagen fiber. The cells are isogenous cell nest 2 to 4, and in the matrix we have abundant elastic fibers, thick, dense, numerous branching. The matrix has type 2 collagen fibers. Okay, so here this is a special stain to show the presence of elastic fibers in the matrix of the elastic cartilage. Fine, and you can see these are the chondrocytes in lacunae. Coming to fibrocartilage, the very characteristic that you should appreciate is the absence of perichondrium. So, it doesn't have a perichondrium. You can see bundles of collagen fibers running in different directions, arranged parallel to the direction of stress. Okay, and these collagen fibers close to it, you can see the fibroblast nuclei. Apart from that, you can also observe chondrocytes in lacuna, right? And the ground substance is very minimal. The collagen fibers that you see here in the matrix is made up of type 1 in contrast to elastic and hyaline cartilage. No perichondrium, chondrocytes in lacuna, right? And bundles of collagen fibers. Matrix has type 1 collagen fiber. Now, time for you to identify. So, this is a high yield topic. Definitely you'll get questions from it, but it's not the same image repeating every time, isn't it? Come on, help me to identify. A is abundant eosinophilic elastic fibers in the matrix. Yes, correct. It is the elastic cartilage. And B here, what do you appreciate of the matrix? It is basophilic, bluish and homogeneous. You don't get to see any collagen fibers there, right? This is going to be the hyaline cartilage. Right? You can see the perichondrium here, right? The perichondrium. And what is C here? You can see chondrocytes in lacuna, right? And the bundles of collagen fibers. And no perichondrium, fibrocartilage. Right? One more. Yes. One is fibrocartilage. Did you guess it right? Abundant collagen fibers, right? Can you appreciate the chondrocytes in lacuna? And 2 is, yes, You can see the eosinophilic collagen fibers in the matrix, right? Elastic cartilage. And 3, yes, it's not that very basophilic. Still, you can appreciate the presence of perichondrium in elastic cartilage and hyaline cartilage. Here, the isogenous cell nest you can make out, and a homogeneous matrix, isn't it? This is going to be hyaline cartilage. The articular surfaces of the bones contributing to the joint, right? They are covered by hyaline cartilage and they are called articular cartilage. But this articular cartilage that covers the articulating surface is devoid of perichondrium. Okay? The perichondrium has a rich blood supply, nerve supply, lymphatics. But within the cartilage, there is no blood vessels, no nerves, no lymphatics. What are the areas where you find these cartilage types? Okay, hyaline cartilage, the best example is the epiphyseal growth plate, right? And then, can you put your fingers over the trachea and feel? That's also made up of hyaline cartilage. Right? Hyaline cartilage is more rigid, strong, isn't it? It can calcify and ossify also. Again, the cartilages of the larynx, the thyroid cartilage, the cricoid cartilage is made up of hyaline cartilage. And can you identify what is this cartilage of the larynx? Arytenoid. Most of the arytenoid is made up of hyaline cartilage. You can see the ribs here, the sternum here. Yes, what is this? Connecting the sternum to the ribs, the costal cartilage. That is also made up of hyaline cartilage. Okay, so the epiphyseal growth plate, the trachea, the cartilages of the larynx, thyroid, cricoid, most of the arytenoid and the costal cartilage are the best examples for hyaline cartilage. What about elastic cartilage? Remember 3 E's. What are they? So, the eustachian tube that you see here connecting the middle ear cavity to the nasopharynx, right? And then the pinna of the ear, external ear. This cartilage here is the epiglottis, right? So the elastic cartilage is found over the eustachian tube, the epiglottis and the pinna of the ear. Apart from that, yes, I told you most of the arytenoid is made up of hyaline cartilage. The apex and the ocal process of the arytenoid are made up of elastic cartilage. Okay, and then the top of the arytenoid, it articulates with 2 small cartilages, do you remember, found within the aryepiglottic fold. What are they? The corniculate and cuneiform. They are also made up of elastic cartilage, right? So apart from the 3 E's, do remember the apex of the arytenoid and the ocal process of the arytenoid and corniculate and cuneiform. What is the feature of the elastic cartilage? Flexibility, right? The ocal process will give attachment to the ocal cord. It has to be flexible throughout the life, right? So it cannot like ossify or calcify. Fibrocartilage, what are the sites in the body where you get to see the fibrocartilage? The fibrocartilage is strong as that of the hyaline cartilage, flexible as that of the elastic cartilage, but this doesn't calcify or ossify. So what is this? In related to your hip joint? Yes, the acetabular labrum. It is made up of fibrocartilage. And in relation to the shoulder joint, the glenoid labrum. Here you can see the menisci of the knee joint made up of fibrocartilage. Also, the articular disc of temporomandibular joint is made up of elastic cartilage. These are the menisci of the tibia. And the best example, the intervertebral disc that lie between the bodies of the vertebra, made up of fibrocartilage. So, what is the type of cartilage shown here? You don't get to see a perichondrium, and you can see, yes, lot of cells there, chondrocytes in lacuna, and in between the pink there is the collagen fiber bundle. Because of absence of perichondrium and the collagen fiber bundle, we are going to call it as the fibrocartilage. Fine. So, articular cartilage is a type of hyaline cartilage without the perichondrium. Non-articular cartilage is same as that of the rest of the hyaline cartilage. Elastic cartilage and fibrocartilage. So, the answer is fibrocartilage. So, in this question, we have discussed in detail about the 3 cartilage types. Okay. And the histological images related to it. We have seen more than 3 types of histological image for each type of cartilage, isn't it? Okay. Now moving on to the second question. Which of the following is most likely seen due to rupture of saccular aneurysm in the brain? Do you know what's the other name for the saccular aneurysm? The berry aneurysm that involves the circle of Willis. And rupture of this berry aneurysm, it produces subarachnoid hemorrhage. Shall we have a quick discussion over this high yield topic? So, what is this picture that you see here? The base of the brain, isn't it? Right? What are the arteries you get to see here? This one here is the vertebral artery. Right? The right and the left vertebral artery, they unite to form the basilar artery that lies over the ventral surface of the pons. And what does this basilar artery terminate into? The posterior cerebral arteries. Can you see it over here? This one here is the posterior cerebral artery. And this is the terminal part of internal carotid artery. The terminal part of the internal carotid artery is going to give rise to 2 terminal branches. This one that you see here arising from the internal carotid and going anteriorly is the smaller terminal branch of internal carotid. We call it as the anterior cerebral artery. Right? This one here is a larger terminal branch of the internal carotid artery, the middle cerebral artery. This one here is the anterior choroidal artery coming from the internal carotid artery. And this branch you can see joining the posterior cerebral artery. This is the posterior communicating artery. So these are the branches of internal carotid over here. The anterior cerebral, middle cerebral, anterior choroidal and the posterior communicating. So the question was about saccular aneurysm, berry aneurysm, right? And I told you it involves the circle of Willis. Where is this circle of Willis? Over here in the base of the brain, right? In the interpeduncular fossa. And in the subarachnoid space of the interpeduncular fossa called the interpeduncular cistern, where you get to see all these branches, right? So let us see what are the arteries contributing to circle of Willis, right? It's a very high yield topic. Once they ask which of the following artery is not contributing to circle of Willis, that's why. So here, this is the terminal part of the internal carotid artery, which contributes to the circle of Willis on the lateral aspect. And yes, coming from the internal carotid, this is the anterior cerebral artery. So the anterior cerebral artery, and then the anterior cerebral artery of both the sides, they are connected by this anterior communicating artery, right? Similarly here, we have the posterior communicating artery, again a branch of the internal carotid artery. And over here, the posterior cerebral artery, which is the terminal branch of the basilar artery, the proximal part of the basilar artery. All this contributes to the circle of Willis. So which branch of internal carotid is not contributing to circle of Willis? I'll show it in black color. The middle cerebral artery. And here this was the anterior choroidal artery, right? They do not contribute to the circle of Willis. Fine. So an aneurysm involving the arteries contributing to the circle of Willis, right? This congenital aneurysm, it's called as the Berry aneurysm. Most commonly involving the anterior communicating artery. So when the intracranial pressure increases, it can rupture. And where are all these blood vessels situated? The circle of Willis is situated in the subarachnoid space. So that will lead to subarachnoid hemorrhage. Understood? Fine. So this is an image showing you blood in the interpeduncular cistern in case of subarachnoid hemorrhage due to rupture of a sacral aneurysm or the Berry aneurysm of circle of Willis. This is the superior sagittal sinus. Can you tell me what are these veins? Draining into the superior sagittal sinus, the cerebral veins. They are also called bridging veins. And in hypertensive patients, when the BP shoots up, when the intracranial pressure increases, these veins, they can rupture, leading to subdural hemorrhage. So where does the blood accumulate in the subdural hemorrhage? In the subdural space that lies below the dura mater, between the dura mater above and the arachnoid below. In this image, can you identify the dura mater, the outermost thick fibrous layer? And you get to see a hematoma here. This is the subdural hematoma, right? Due to rupture of the bridging veins or the cerebral veins. So this is again a very frequently asked question. Extradural hemorrhage, epidural hemorrhage and subdural hemorrhage in the image given here, right? So here, this is the extradural hemorrhage. And where do you see it's located? I have to redraw this. 1 second, I'll do this slide again. It's in bits and pieces. Yeah. So this again is a very frequently asked question in your competitive examination, extradural hemorrhage and subdural hemorrhage, right? So this is the extradural hemorrhage. Where is it located? I would like to show you the dura mater in this picture, right? So this one, which I'm drawing in green color, this is the dura mater, right? And you can see here in the extradural hemorrhage, the blood lies outside the dura mater. The dura gets stripped from the inner surface of the skull. What are the two layers of the dura mater? The meningeal layer and endosteal layer, right? There is no epidural space in the cranial cavity. We have epidural space outside the dura mater only in the vertebral canal. Remember? Okay. So what has happened here? The collection of the blood has stripped the dura from the inner surface of the skull. And what is the shape of the hematoma here? It is biconvex lens shaped, right? The location is, it lies outside the dura mater, right? And rupture of which vessel causes this extradural hemorrhage? Any idea? It's the middle meningeal artery, right? The rupture of the middle meningeal artery related to the pterion. Yes, so it's going to be an arterial bleed in case of extradural hemorrhage. What about subdural hemorrhage? So this is the subdural hemorrhage you see here. It lies inner to the dura mater, where again in the subdural space between the dura mater and the arachnoid, right? And the shape of the hematoma that you see here, it is long and crescentic. So this is the hematoma that you see here in the subdural hemorrhage. Yes, beneath the dura mater. And yes, just now we saw, right, the vessel involved here is the cerebral veins or the bridging veins. Hence, it is going to be a venous bleed. Okay, in both the conditions, because of the enlarging size of the hematoma and the parenchyma getting compressed, the patient will present with symptoms related to raised intracranial tension. It can manifest as headache, vomiting, the cognition can be impaired, and yes, the patient can move on to unconsciousness or coma. So what is the cause for extradural hemorrhage causing rupture of the middle meningeal artery? We know it is related to the pterion, right? And the pterion is situated over the lateral aspect of the skull. So any trauma to the lateral aspect of the skull can rupture the middle meningeal vessels, the middle meningeal artery, right? And the symptoms, just now I told, right, it can manifest from headache and then yes, vomiting and signs of other intracranial tension. Yeah, unconsciousness on all that. But here in extradural hemorrhage, the patient, he remains non-symptomatic. He looks normal for some time and then goes to unconsciousness. This period is described as lucid interval. Whereas in subdural hemorrhage, it could be due to a fall, a road traffic accident, right? And very common in elderly, epileptic patients, and alcoholics, right? So here again, there can be altered cognition. So you should be definitely able to identify whether it's extradural hemorrhage or subdural hemorrhage just by looking into the picture, okay? And yes, what are the types of hemorrhage? So we have seen so far, one is the subarachnoid hemorrhage due to rupture of the berry aneurysm. And then just now we saw extradural hemorrhage, that is due to rupture of the middle meningeal vessels, right? And subdural hemorrhage due to rupture of the cerebral veins. Fine? So which of the following is most likely seen due to rupture of sacral aneurysm in the brain? Subarachnoid hemorrhage. So in this question, we have discussed branches of the internal carotid artery. We identified it in the image, and then we saw both circle of Ellis, which arteries contribute and which do not contribute, right? And the types of hemorrhage, intracranial hemorrhage, right? A patient presented with unilateral retroorbital headache, photophobia, excessive tears. He also complains of hemifacial pain on clenching of teeth. On examination, pupillary reaction is normal, light reflex, accommodation reflexes are normal. Which of the following structure is affected? So they have actually given an image-based question to identify A, B, C, D and then answer from it. Okay, so A here is the optic nerve. What is the function of optic nerve? Vision, isn't it? Okay, but nowhere symptoms related to visual defect or visual loss is given. So we'll just leave off optic nerve. Coming to oculomotor nerve, they've told that the light reflex, accommodation reflex, pupillary reaction is all normal. So oculomotor nerve is also normal. And then let's see facial nerve. Please remember, right? In this patient, the symptoms are related to sensory disturbance or paralysis of muscles. Yeah, it's exclusively talking about sensory disturbance, right? Yeah, and this facial nerve, it doesn't have any cutaneous branch. It supplies the muscle of the face but not the skin of the face. So we can just exclude facial nerve also. So the best option is going to be trigeminal nerve. But you should be able to identify it in the image, right? Come on, let us identify it. A here is the optic nerve. And this one B here is the third nerve, the oculomotor nerve, right? And this one C here is the thickest of all the cranial nerves, which you couldn't make a mistake, the trigeminal nerve. And this one here is the internal acoustic meatus. And D here is the facial nerve. So if you are not happy with this image, let's move on to another image. Come on, where you will be able to identify it with much more clarity. So this here is the optic canal, and the nerve that you see here is the optic nerve, the second cranial nerve. This here is the oculomotor nerve, right? And this one here is the thinnest of all the nerves. Not only that, this is the only cranial nerve that exits from the dorsal surface of the brainstem. The fourth cranial nerve, trochlear nerve. And as I told you, this one you can never make a mistake. The thickest of all the cranial nerves, the fifth nerve, trigeminal nerve, right? And here again, this one here is the sixth nerve, abducent nerve. The internal acoustic meatus transmitting the seventh, and this one, the vestibulocochlear nerve. This is the jugular foramen. Traversing the jugular foramen is the ninth cranial nerve, glossopharyngeal nerve, the vagus, the 10th cranial nerve, and the accessory nerve. What are the two components of the accessory nerve? Cranial and spinal. This root, can you see here, coming through the foramen magnum and joining some nerve in the jugular foramen, is the spinal accessory nerve, right? And over here, these are the rootlets of the 12th nerve, the hypoglossal nerve in the hypoglossal canal, right? So this is a very, very important high yield image showing the cranial nerve exit in the cranial cavity. Okay, so definitely you should be able to identify, because no one is going to ask you for an identification. The question is going to be related to the identified structure. Okay, so make sure you're thorough with the identification of these cranial nerves, right? So now let's move on to the trigeminal nerve. What are the three divisions of the trigeminal nerve? The ophthalmic nerve, the maxillary nerve, and the mandibular nerve. And we know that the trigeminal nerve is a mixed nerve. Most of it is going to be sensory. Yes? Yeah. And few fibers of it, it's going to be motor. That is why we call it as the mixed nerve. The ophthalmic nerve is entirely sensory. The maxillary division is also entirely sensory. The mandibular division is sensory, as well as it carries the motor fibers of the trigeminal nerve. Okay, and the nuclei related to the trigeminal nerve, the sensory nucleus, they are 3 in number in the brainstem. The first one is the spinal nucleus of the trigeminal nerve that receives pain and temperature from face. And then we have the chief sensory nucleus of the trigeminal nerve that receives the touch sensation from face. And then again, we have the mesencephalic nucleus of the trigeminal nerve, which receives the proprioceptive information from the muscles of mastication and the muscles that move the eyeball. Okay, if you need more details, you can have a look into the head and neck cranial nerves, right, on that session. So, plus the motor nucleus of the trigeminal nerve. So, totally 3 sensory nucleus and 1 motor nucleus. The motor nucleus is going to supply the 4 muscles of mastication, masseter, temporalis, medial pterygoid, lateral pterygoid, and 2 tensors, tensa tympani, tensa veli palatini, and 2 more, the anterior belly of digastric as well as the mylohyoid. And remember, the mandibular nerve is the nerve of the first pharyngeal arch, special visceral efferent column. Yes, we have discussed in detail in head and neck session, right? So, for further basic details, refer to head and neck session of the same, right? So, the case scenario given, it describes the patient having sensory disturbance over the upper and the mid part of the face corresponding to ophthalmic division and maxillary division of the trigeminal nerve. So definitely we should learn the name of the branches of these divisions. The area shown here in green color, that is the skin of the face supplied by ophthalmic division of trigeminal nerve. So this one here is the lacrimal nerve. Just medial to it, this is the supraorbital nerve. And this one more medial is the supratrochlear nerve, right? And this one below is the infratrochlear nerve. This one here is the external nasal nerve. Follow, okay? I have a lot of questions at the end of it. So these are all branches of the ophthalmic division of trigeminal nerve, right? Now, here, this one supplying the skin over the lower eyelid and the upper part of the cheek is the infraorbital nerve. This infraorbital nerve is the main continuation of maxillary nerve, right? And this one over here is the zygomaticofacial nerve, and this here is the zygomaticotemporal nerve. All these are branches of maxillary division of the trigeminal nerve, right? Now, this nerve that supplies the skin of the lower lip and the skin of the chin, it is the mental nerve, right? And this one here, yes, that is going to be the buccal branch. And just above, this is the auriculotemporal nerve. And all these are branches of mandibular division of trigeminal nerve. Now, ready for my questions? Come on quickly, looking into the image. Can you tell me, what is the nerve supply of tip of nose? Yes, it's ophthalmic division of the trigeminal nerve. Upper eyelid, ophthalmic division of trigeminal nerve. Lower eyelid, the sides of the nose and upper cheek, maxillary division of trigeminal nerve. Upper lip, maxillary division of trigeminal nerve. What about the lower lip and chin, right? The lower part of cheek, mandibular division of trigeminal nerve, skin over the parotid, great auricular nerve, okay, from the cervical plexus. Now, the ophthalmic division of the trigeminal nerve, it has three branches: lacrimal nerve, the one that you see here, and then frontal nerve. The frontal nerve will divide into two, the one just now we saw, right? Supraorbital and supratrochlear, right? And the third one, which you see here, is the main continuation, right? It is the nasociliary nerve, right? The nasociliary nerve will give rise to posterior ethmoidal nerve that you see here, the anterior ethmoidal nerve. The posterior ethmoidal nerve will supply the sphenoidal sinus and the posterior ethmoidal sinus. The anterior ethmoidal nerve will supply the middle ethmoidal and the anterior ethmoidal. It will enter the nasal cavity and then it will emerge as the external nasal nerve. Also branches from the nasociliary nerve. You can see it supplying the eyeball, right? This is the ciliary ganglia in the orbit. The sensory fibers through the nasociliary nerve, right? They pass through the ciliary ganglia. So on the whole, you can tell me the ophthalmic division of the trigeminal nerve, it carries the sensation from the eyeball, okay? And also the skin over the upper part of the face. And through the nasociliary nerve, the nasal cavity also, and the ethmoidal and sphenoidal sinuses, right? The lacrimal nerve innervates the lacrimal gland. Okay, it receives the fibers through the zygomatico-temporal branch of maxillary nerve and the skin of the lateral part of upper eyelid. The lacrimal nerve and the frontal nerve, you know how do they enter the orbit? Through the lateral compartment of superior orbital fissure. And the nasociliary nerve, it passes through the intermediate compartment of superior orbital fissure, right? So, where is the maxillary nerve here? This is the maxillary nerve. And you can see a foramen here. The maxillary nerve, it passes through the foramen rotundum. And it reaches this area that you see here, which is called the pterygopalatine fossa. And in the pterygopalatine fossa, can you see here there's one ganglia, the pterygopalatine ganglia, right? So this maxillary nerve through the ganglionic branches, it will communicate with the pterygopalatine ganglia. The main continuation of this maxillary nerve will enter the orbit as the infraorbital nerve. The branches of the maxillary nerve will of course supply the maxillary sinus, the upper jaw, and we saw, right, the skin over the mid part of the face, right? So yes, any involvement of this nerve can lead to pain over the territory supplied by it. And lastly, the mandibular division of the trigeminal nerve. Remember, this is important. The ophthalmic and the maxillary division of trigeminal nerve are entirely sensory, but this is a mixed nerve. It has the motor component also here. So this is the mandibular division of the trigeminal nerve. I would like to point out the mandibular nerve. This is the mandibular division of the trigeminal nerve. You can see it passing through a foramen. Yes, that foramen here that you see is the foramen ovale. The mandibular nerve, it exits the middle cranial fossa through the foramen ovale and reaches this area called the infratemporal fossa, right? And in the infratemporal fossa here, it's going to be related to a ganglia called the optic ganglia, right? And what are the branches coming from this mandibular nerve? It has a trunk. The trunk will then quickly divide into a anterior division and posterior division. Branches coming from the trunk will include nervus spinosum and nerve to medial pterygoid. This nerve to medial pterygoid will pass through the optic ganglia without any synapsing and will go ahead to supply, of course, the medial pterygoid, but also the two tensors, tensor tympani and tensor palatini. Tensor tympani, where do you get to see it? Within the middle ear, right? And tensor veli palatini is a muscle of the soft palate, right? So here you can see the trunk of the mandibular nerve. This nerve, right, is the nervus spinosum. The nervus spinosum and the middle meningeal artery, it passes through the foramen spinosum, right? Now, let us see the branches coming from the anterior division of the mandibular nerve. They supply the muscles of mastication. So, the masseteric nerve that supplies masseter muscle, the deep temporal nerves that supply the temporalis muscle, the nerve to lateral pterygoid. The nerve to medial pterygoid also, the nerve to medial pterygoid also comes from mandibular nerve, but from which part of the mandibular nerve? From the trunk, isn't it? And one more nerve, very important, the buccal branch of mandibular nerve. Any guess why am I showing it in red color? Please remember, these three are motor. The buccal branch of mandibular nerve is sensory. Why it should be highlighted? There is a muscle over the cheek called buccinator, right? This is your buccinator muscle. And this buccinator muscle is going to be supplied by buccal branch of facial nerve, the lower buccal branch of facial nerve. So you shouldn't confuse this buccal branch of facial nerve, that is motor, with this buccal branch of mandibular nerve. First point. Another thing is that this buccal branch of mandibular nerve, it pierces the buccinator muscle to supply the skin of the cheek, right? So this is again a confusing point. The buccal branch of mandibular nerve will pierce the buccinator but doesn't supply it because it's not a motor nerve. It supplies the overlying cheek, the skin of the cheek. Understood? So 4 branches from the anterior division, 3 motor and 1 sensory. Now let us move on to the branches coming from the posterior division of the trigeminal nerve. Very, very, very important, right? Now let us see the branches coming from the posterior division. There are 3 branches coming from the posterior division and it is important to know them here, right? The first one is this one, the inferior alveolar nerve. You know why it is called inferior alveolar nerve? It is going to supply the teeth of the lower jaw, all the teeth of the lower jaw, the molar, the premolar, the canine and the incisor, right? And there was one question in the competitive examination pointing to a foramen on the inner surface of the mandible asking what passes through it. Okay, so that is the inferior alveolar nerve passing through the mandibular foramen, right? So you can mistake it for mandibular nerve entering the mandibular foramen. It's not so. The mandibular foramen is passing through the, the mandibular nerve is passing through the foramen ovale. The structure passing through the mandibular foramen on the inner surface of the mandible is this inferior alveolar nerve. But before it enters that mandibular foramen, it will give this branch. It is called as nerve to mylohyoid. This is the mylohyoid muscle. So this nerve to mylohyoid will of course supply the mylohyoid. In addition, it supplies the anterior belly of digastric. The posterior belly is supplied by the facial nerve. Okay, so that's about the inferior alveolar nerve. Moving on, totally I told you there are 3 branches, right? Moving on to the second branch coming from the posterior division. This one here is the lingual nerve. As the name suggests, the lingual nerve, it receives the general sensation from the tongue, from the anterior 2/3 of the tongue. Another interesting feature of this lingual nerve is, yes, come on, tell me your chocolate question. Can you see a nerve joining the lingual nerve from behind? Can you tell me what could this be? This one, yes, which is shown in pink color, is the chorda tympani branch of facial nerve, right? This chorda tympani branch of facial nerve, you know what it does? It hands over its fibers. It hands over all the fibers it carries to the lingual nerve at this juncture. It carries the preganglionic parasympathetic fibers for the secretomotor fibers for the submandibular and sublingual salivary gland. Right? So that's about the lingual nerve. And the third one is this branch that you see here, arising as 2 roots and enclosing the middle meningeal artery between its 2 roots. Yes, you're right. It's the auriculotemporal nerve. Right? So, of course, it supplies the temple of the forehead, right, by the graying of the hair scalps. It supplies the auricle, but most important, please remember, it carries the postganglionic fibers for the parotid, right? So, if you go to head and neck session, the same topic on mandibular division of trigeminal nerve, we would have talked about Frey's syndrome, isn't it? Yeah, any details you need, please refer to that session. To summarize, the branches coming from the mandibular nerve, from the trunk, nervus spinosus and nerve to medial pterygoid that supplies medial pterygoid, tensor tympani and tensor veli palatini. From the anterior division, yes, the branches to the muscles of mastication other than medial pterygoid, nerve to lateral pterygoid, the deep temporal nerve supplying the temporalis muscle and masseteric nerve, plus 1 sensory branch, the buccal branch. And from the posterior division, 3 nerves, the lingual nerve, inferior alveolar nerve and the auriculotemporal nerve. Of these 3 divisions, which one is motor? The inferior alveolar nerve, right? Okay. So, a patient presented with unilateral retroorbital headache, photophobia, excessive tears, all referring to ophthalmic division of trigeminal nerve, right? And hemifacial pain on clenching of teeth, right? Referring to the other divisions of the trigeminal nerve, pain over the face, we know it's trigeminal nerve. On examination, yes, the oculomotor component was normal. Which one is affected? The structure C. So, in this question, we have seen about, yeah, the cranial nerves exit from the cranial cavity, the sensory innervation over the face, the trigeminal nerve, its 3 divisions in detail about the mandibular nerve, and the nerve supply of the muscles of mastication, right? Hope it was useful for you. Yes, and the high yield image, the exit of cranial nerves from the cranial cavity, and the other images also equally important. Fine. So, hope this session was useful for you. If you want further details, you can look into the corresponding session in your gross anatomy or embryology, right? Happy learning. Thank you.